Welcome to Module 5 of BDAP 101, where we will be briefly discussing private health insurance. The first type of private health insurance we'll be discussing is the employer-sponsored insurance, also abbreviated ESI. So ESI is paid for with part of the wages that are paid to the employee that go towards the insurance premium, and the employer also pays a portion of that premium. Usually the employee's portion is taken out of a paycheck automatically, and if someone stops working, there aren't wages to pay their share of the premium, so the plan is likely to be canceled. BDAP can pay for these ESI premiums if the premium offers pharmacy coverage. However, in our experience, most employers will not accept third-party payments. Most employers would prefer to just deduct the employee's share of the premium directly from their paycheck versus taking a check from an outside company. COBRA coverage is a continuation of coverage for an employer-sponsored plan if the employment is ended. Generally, this is an 18-month extension of the coverage the person would have from their employer. So if the employer no longer pays its part of the insurance premium, so the person would pay a full premium. If a client is entitled to COBRA benefits, their health plan has to give them notice of their right to continue benefits provided by the plan. The client generally has 60 days to accept coverage. Otherwise, they will lose all rights to benefits and risk losing credible coverage. And once COBRA coverage is chosen, the client is required to pay for the coverage. BDAP may assist clients with health insurance coverage through COBRA with the cost of their premium, medication copays, or deductible amounts. I will say that we ask you that you work with your FBS to determine if COBRA is the better fit or if our ADAP sponsored insurance plan would be a better fit based on the benefits of that plan and the cost. So self-paid plans are something that you'll be working with pretty frequently. This is available through the health insurance marketplace and also off marketplace. This began in 2013 as part of the 2010 Affordable Care Act, also known as the ACA, also known as Obamacare. In self-paid plans through the marketplace, you buy private insurance plans that meet the ACA standards, which includes covering pre-existing conditions. There is an option for a tax credit if you fall between 100 and 400% of the FPL. And the way this tax credit works is it either lowers your monthly premium amount or it changes the amount owed or refunded when you go to file your taxes. For us, we're still using the term ADAP sponsored insurance or ASI, even though we've transitioned to BDAP. We just haven't found a really good tool to say BSI just yet, but helping BDAP clients purchase and maintain their comprehensive health insurance is more cost effective than paying for the full cost of their medications, and it improves health outcomes by providing access to the full spectrum of medical care beyond the HIV outpatient care setting and medications that are available through the Ryan White program. So there are certain types of clients who generally enroll onto ASI, and these could be clients who are not offered insurance by their employer. They're clients who cannot afford the insurance offered by their employer, or their employer's coverage is not very robust. These are clients who are between 139 and 500% of the FPL with no other coverage options, clients who are on the 5-year Medicaid ban, clients who are categorically ineligible for public benefits, and also self-employed clients. Currently, I was using 2 carriers for our sponsored insurance program. One is Wellmark Blue Cross and Blue Shield. That is available via healthcare.gov for those clients who are US citizens and eligible immigrants. And Medica is available directly through Medica off marketplace for those clients who are categorically ineligible for public benefits. A question that we often get is, well, what does BDAP pay for versus what Ryan White Client Services pay for? So I've included this chart to break down what we can and cannot pay for. So when it comes to someone who's enrolled in an ADAP sponsored insurance plan, the BDAP will pay for the cost of the premium. This is done generally twice a year, and we send out instructions for how to submit premium payments to us. When it comes to copays or coinsurance for eligible prescriptions, the BDAP also pays for that. It's done automatically. Nucara bills the BDAP for the cost of the client's prescriptions, and anything that we might not cover can generally be billed to Ryan White utilizing your agency's funds. Doctor visits, lab draws, and durable medical equipment are not covered by BDAP, but you could use Ryan White funds to pay for that. The exception is for long-acting injectable HIV medication. We do pay for that through the BDAP. If your client has an emergency room visit or an inpatient hospital stay, please note that both streams of Ryan White funding are explicitly restricted from covering the cost of emergency room or inpatient visits. If your client cannot afford the cost of their emergency room visit or an inpatient hospital stay, we would encourage you to work with the hospital's financial assistance team to assist the client in applying for financial relief. And if you have a client that is undergoing surgery that requires general anesthesia, Ryan White is explicitly restricted from covering this cost, and we would also encourage you to work with the hospital financial assistance team to assist the client in applying for relief. When paying insurance premiums, there's a couple of terms that we want to point out to you. One is a binder payment. This is the first payment of an insurance plan. It completes the enrollment, it has to be paid by the due date, and coverage will start when the payment is received. For BDAP, we currently pay all premiums semi-annually. So we pay in January for January to June, and again in July for July to December. Premium payments generally have a grace period, so this is an amount of time after the due date a premium can be received before the plan is canceled, but this does not apply to binder statements or binder payments. And I cannot emphasize this enough, that paying premiums on time is critical to ending the epidemic by keeping clients insured and retained in care. It helps us stretch our really scarce federal dollars to go further when that client has comprehensive health care.